Yo, 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 everybody. What is up? Welcome back to another episode of the What Now podcast. We have a different gear today. Zach, tell everybody who we have as an awesome, amazing, long-awaited guest.
Yes, sir, and yes, ma'am. So today we are joined by none other than one of our best friend's wives and someone becoming our friend as well. Dr. Whitley Caruso is in the booth with us today, coming to us from Houston. Really quick bio on Dr. Whitley. She first opened her practice, Vital Family Chiropractic, in June of 2018. She now has scaled to having 3 chiropractors, 1 front desk CA, as well as 1 virtual assistant, and is even now teaching other chiropractors how to implement chiropractic work in the cranial chiros, as well as doing one-on-one coaching all through her personal side of things, which we will get into. And she graduated from TCC, Texas Chiropractic College, in December 2015, which is almost 10 years ago, which she says is wild. So welcome to the What Now podcast, Dr. Whitley.
Thanks, guys. So glad to be here.
Yeah, I mean, I feel like this is long-awaited. I feel like I know you so well because obviously you're married to one of our best friends, John, and I feel like we've gotten to know each other like really personally. Like I feel like I know you as like a wife and a mom, but I really haven't gotten to dive into you as a chiropractor, which is a big part of your life. I didn't know that you had 1 CA. I knew that you had a really big rockin' office and you had a couple doctors, but I didn't know that you only had 1 CA and a virtual assistant. That's crazy.
Yeah, she's awesome. We always have a lot of interns that run through the office, so we use them as like our tech CAs or
That's nice.
Nice.
clean table people. So we really love having the interns and really rely on them as being almost like a second CA.
Yeah, that concierge person in the office is just next level.
Yeah.
Yeah, so tell everybody kind of what's like the backstory of Vital. Like, how did you get to Houston, and then what made you decide like, yeah, this is what we're doing. We're opening up.
Yeah, so I think it goes way, way back. So I was a super sick kid. Grew up in a very traditional medically model household. My dad is West Indian. So like coming from an Indian family, you either became a doctor or an engineer. And so I planned on going to medical school ever since I was a little kid. And then found myself in undergrad with migraine headaches. And I was a competitive cheerleader in high school, had been to a chiropractor, very diversified technique, put me on an inversion table. And I was like, okay, chiropractic is baloney. It did not help me. I was super hypermobile, really flexible as a cheerleader. So he adjusted me and I was like, this wasn't anything I couldn't have done myself. As a 19-year-old or even younger than that, I guess. So fast forward in college, I did marketing for a bank and I met a chiropractor basically who was doing a screening and he had a symptom chart and headaches was on there. I had migraine headaches, was on literally, this was pre apps. I did have an iPhone, but I had an index card of all the prescriptions that I took that was in my purse. So I would keep that index card with me. And 2 of them were migraine medications. And he was like, I can help you with your migraines. And I was like, bro, like, I'm good. Like, I've been to a chiropractor. I know what you guys do. And it was a total God thing of how I ended up in his office. I actually drove past another chiropractor to go to his office. And as a patient, he handed me a green book.
Wow.
And he actually told me about chiropractic. And I remember my first adjustment, he adjusted me, and my whole life I had chronic constipation, thought it was totally normal to have maybe 1 bowel movement a week, maybe one every two weeks. And then the first time he adjusted me, that changed. And I was like, bro, you broke me. Like something is wrong. Like what happened? And within a couple of weeks, I started getting off my migraine medication. And then I think at that point, that's when he handed me a green book. And he was like, why do you want to go to med school? You don't want to take drugs. Why do you want to give people drugs? And I was like, okay, good point. And I said, well, I know God really wants me to serve kids. So like I wanted to be a pediatric orthopedic specialist.
Mm-hmm.
And so he was like, you can see kids and be a chiropractor. And so he started telling me all these stories about seeing kids as a chiropractor. And basically the rest is history. He told me not to go to TCC, but of course I was 19. So I thought I knew everything and thought he was wrong. He was a life grad. Anyways, fought like my way through chiropractic school. I was in chiropractic school within a year from that. Fought my way through chiropractic school in that like, I knew what real chiropractic looked like. I knew what principal chiropractic looked like. I knew what chiropractic from a wellness and vitalistic perspective looked like. And everyone that I went to school with did not. And they thought I was crazy. I had professors that would call me out in class and just talk crap. People who the lady at the bookstore knew me because I was always asking her to order green books for me. And I would be like, can you order this one? And she was like, yeah, I guess. So that was how I made it through chiropractic school. I worked all through chiropractic school. So I have a really amazing family, but not one that ever supported me financially. I had to work all throughout chiropractic school. So I was part of a big group of chiropractors. And I say that's where I grew up in chiropractic. And those docs really poured into me and really poured into me from like a principal chiropractic standpoint. But then also I learned a ton of marketing in that way. So I would do screenings all throughout chiropractic school. I had docs that would fly me all around the country to screen for them. Yeah. And so that was really how I got into chiropractic, worked for a guy who was part of that bigger company for a little while. And then a couple years in, always knew I wanted my own office, but then decided to open up Vital. And it was a huge leap of faith, but it's been amazing ever since. That's the long and the short of it.
That's really cool. That's really cool. Had no idea. That's awesome. And then kind of with that, or expanding on that, opening Vital in 2018, for those that might not know, you are super niche. Like when I think of niche, I often think of like Vital and the fact that you serve a very niche community. Did you open up and like right away 2018 you were like, I'm seeing moms and babies and we're doing deep cranial work and that kind of stuff? Or how did you get so niche down?
So that's a super great question, because one of the things that I've learned being in practice so long is that whatever God really puts on your heart, stick to that, no matter what anybody tells you. So I actually had a friend, well-meaning friend, who told me, you can never just see moms and babies. And so when I first opened up, I did a bunch of screenings before I opened. My office grew to 100 patient visits a week in 6 weeks. So we like blew up because I'd put in the marketing efforts before. And at that point, like the first, I would say, I opened in June. The first 6 months, I kind of saw everybody. And then as the schedule started to build, and because I did SOT cranial work at the time, and then was learning from Carol Phillips and doing some dynamic body balancing stuff too, I started to niche down from there, where all of my referrals were coming from lactation consultants. I was having pediatric dentists reach out to me and ask me what I was doing to these babies and how are they getting, like, recovering from tongue tie releases so quickly, and how are they ready for a release so quickly. So I would say I definitely did not know that cranial work was my thing until it was the thing that set me apart. But I always knew I wanted to serve moms and babies. So within about 6 months of opening, we stopped accepting adult male patients.
Yeah, that's crazy. I mean, I think about my practice though too, and like as a man, like I'm in the pediatric and prenatal space as well, and I would say that we actually only get male patients when it's the husband of the mom and the kid, or like we only get the dad, like, and it's pretty consistent. But that's really where all of our male patients come from. Is basically all of our like cold reach out people are either babies or moms too.
Yeah.
And I think that's just like a really special way to build your practice. It's really awesome. I feel like a very sore thumb in the practice because I'm the only guy in our practice. But speaking of like, I mean, I obviously know kind of what you're talking about since I'm in the pediatric and prenatal space, but not everybody is there. Can you tell our listeners and really explain to us like what is cranial work
Yeah.
and like how do you learn it? Where do you go to do that?
Yeah. I would say, Spencer, like what you said, like you're the sore thumb, but I think it's also just like, John is the male in a pediatric prenatal office too. Like obviously he sees a little bit more expanded than that and niche than that too. And at the same time, as a mom, it's really important to have men that can hold space
Mm-hmm.
in that, right? Because postpartum and brand new babies is such a vulnerable time. So having a man be able to hold space in that, I think says a lot about you as a doc. So yeah, just wanted to point that out. So when we talk about cranial work, we do intraoral and extraoral work. So meaning like the cranium, I feel like a lot of people, when I was in school, right, which was a million years ago is what it feels like now. I always tell people school is like a bad dream. It was like a bad dream that I know y'all had a better school experience than I did, but for me, it was like a really bad dream that lasted 3.5 years. And now it's over. But when I was in school, we were taught that the cranium doesn't move, that the
Yep.
cranial bones are fused, especially in an adult. The cranium doesn't move, and we know that that's completely untrue. And so when we say cranial work, we're working with the cranial fascial system. Like we're working with the fascial system of the cranium. So we're
Hmm.
working with the dural meningeal system. So we're really actually directly impacting the brain when we're doing that specific cranial work. The way that we do it is we clear the fascial system of the cranium, and then we also use specific intraoral points to help specific cranial bones move as well.
Hmm.
That helps the cranium as a pump, pumping cerebral spinal fluid all the way from our cranium down our spinal cord to our sacrum and then back up. So, in my opinion, cranial, like doing specific cranial work is the key to having a nervous system based practice because you're actually directly impacting the brain. You're affecting the tension within the dura, which affects, the different pieces of the brain. And then babies, because babies are so driven by their nervous system, their cranium also impacts all basic function. So when we talk about feeding, swallowing, even just overall comfort, vagus nerve exits the cranium, right? And so for these super colicky babies that have a colic, to me just is another term for subluxated baby.
Yeah.
For
Just
these
chronically
colicky
stressed baby.
babies, yeah, super stressed baby. And unfortunately, it's wild having been in practice as long as I have, because and then also having a kid, seeing what people do to their babies out of just pure like ignorance and also desperation for moms of in the name of trying to get sleep or trying to be able to cook dinner, right? We put our babies in devices, whether they're a bouncer or I practice in an area where a lot of people use the snoo bassinet. So for those people that
Hmm.
may not know what that is, it's essentially a swaddle, which is white. And so it looks very similar to a straight jacket that goes in a bassinet that senses the baby's movement and will move and rock the baby back to sleep. So if a baby is not sleeping, the bassinet almost acts as a secondary mechanism to help them go back to sleep, which in theory sounds really nice, but we're designed for human connection. So it's things like that that I think impact the cranium. So I think now, even now, more than when I even started practicing almost 10 years ago, we're seeing way more cranial stuff than we did back then.
Percent. I would say like even in my short time just practicing in 2 years, over this last year, I've seen more babies with head shape and cranial issues. Like I feel like I do more cranials, and especially after learning them and becoming aware of them, just see like really poor cranial patterns, really poor like intraoral fascial issues. Hey dog, chill. Um,
She wants to be on the podcast too.
well, no, sometimes she'll bark whenever I be saying the truth.
Oh yeah.
She's like, oh, I mean, so she's a dog, she's unvaccinated and all that stuff, so she's like really sensitive to kids and everything. She kind of picks up on things.
Yeah.
She'll bark at kids like whenever like babies who are like really big in distress. She'll like nose me and then like point toward the baby. It's
That's
because we live right
awesome.
across from a park, and so she always picks up on like the kids being stressed. But anyway, speaking of stressed kids and stressed parents and parents doing everything in the name of trying to get their baby to sleep, I feel like there's a lot of education that has to go around how to like what's going on with the baby. Like so many parents are just so disempowered by their OB or their delivering doc, like that they don't know anything about their baby and they just think like, okay, the baby just needs to shut up and I'm tired. And
Mhm.
so like how do you explain the concept of the dura and the cranial system to parents? Because like we know what the duromeningeal system is, right? But
Mhm.
maybe even some chiropractors don't. How do you explain that?
Yeah, it's a super great question. So I'm the queen of analogies. I love a good analogy because I think that makes something really complex, really relatable. And as amazingly cerebral as my husband is, I am not that gal, right? So I'm not going to pull something out from like second or third trimester and like be able, be able to regurgitate it word for word. That's just not how my brain works. So the way that we explain the cranium is we explain it to parents like it's tectonic plates. So it's basically tectonic plates that make up your baby's cranium. And we always show them a cranial model too. And we say all of those plates are supposed to fold over one another as baby exits the body, right? So whether it's the birth canal or via C-section, all of those plates should fold over one another. And then whenever a baby comes out and they're under the forces of gravity, then those plates should pop out and set one right very next to one another. And that's important because if during that process, a well meaning birth provider puts their hand on the baby's cranium, that actually prevents that cranial bone from being able to move in the way that it was designed and set next to the other cranial bones. And so that's how that starts, is the tectonic plates. And then the cranium acts as a pump. So it pumps cerebral spinal fluid, which is like brake fluid for your nervous system. It
Mm.
pumps that cerebral spinal fluid from your brain all the way down to your tailbone and then pumps that fluid back up towards your brain. So I always tell parents it's important because that's helping pull toxins away from the brain and it actually cools the brain. So especially after birth, which even in the most beautiful births is 60 to 80 pounds of pressure on the cranium and on the body. So the brain needs cooling down. It needs that anti-inflammatory effect. So it's cooling that down, bringing toxins and away from the brain as well. And then it's also pumping nutrients towards the brain. And then I always tell parents too, when it comes to intraoral work, it's like we're working on a pier and beam house. So we're going inside the mouth to influence the outside of the house. So we're going inside the mouth to influence the cranial bones on the outside. I always try to help them understand too that the brain craves symmetry and it wants symmetrical movement that comes from the body as well as from the cranium. And so we want all those cranial bones to move symmetrically. Most parents understand that if their kid is only turning their head to one side, that's kind of not good. But a lot of parents don't understand that when a baby starts crawling, if they're doing something funky with one leg, that also is telling us that there's imbalance in their brain. So we
Mhm.
try to really give them like key things to be looking for, and really break it down in that way to be able to explain it to people.
It's awesome. And with that, I'm the only listener because I'm one of the few that probably isn't pediatric prenatal. But what does that education look like? Are you just like day one, just like sitting them down for 5 hours and explaining tectonic plates and cranial bones and all of that? How does that education look like in a weightless practice like y'all's?
Yeah, so that's a great question. It's really just that. We talk about nervous system based chiropractic or like we talk about three different types of chiropractic. We're nervous system based chiros. We use MC2 as like our primary form of analysis, right? So obviously patients don't know what that is, but we talk to them about like we're looking for neurological indicators and part of those neurological indicators are also in the cranium. So then we explain especially if it's a baby, right, that is coming for cranial work or even we see a lot of airway cases, even adults with airway stuff. So then I'll just explain to them, depending on how long ago their birth was or what we're seeing, I may explain the tectonic plates. I may just say, like, we're going to be looking at balancing their cranium in our exam. We're going to be looking at specific things. And then when we go over it, we will go over why we want that symmetry, what those indicators are, what those objective measures are. We measure the cranium from side to side. So it's just as simple as that. And I think that when you can give those really simple analogies, most people are like, okay, yeah, like we want it even. That makes sense.
Yeah.
So,
Yeah, Zach. I mean, one of the biggest things, how I say, like, a lot of times we get the husband under care. A lot of times it's whenever we're working on the baby or we're working on the mom, and I do some intraorals on the mom or the baby, and then I say, yeah, and this helps like in adults. This helps things like it just opens up the airway, and then the mom will automatically be like, so you can help. You're telling me that my husband can stop snoring, and that's whenever the husband is in there, because when the husband does stop snoring, then mom is like, you are the lifesaver, like, oh my gosh, because I mean, I snore, and
I
so I
was
need
about to
some
say
good
we
some
need
airway
some
stuff.
some intraoral on Spencer to stop him from snoring.
Yeah, I do be snoring. But
yeah.
Whitley, what's a place like where did you learn? Because I mean, you teach a really amazing course on cranials, but where did you learn all of the cranial stuff? Because I mean, obviously, if you're going to TCC and it's not a place that's super principled or all those things, you're probably learning like stretching and exercises and all those things. Where did you go to learn all of this stuff?
Yeah, no, super, super good question. I definitely did not learn cranial work in school. So I was fortunate enough to have gone through the ICPA when Marty Rosen was still teaching.
Mhm.
So before now, he has really, like, since leaving the ICPA, he's really expanded his teaching a lot. And I would say I'm very much a Dr. Marty Rosen, Dr. Nancy Watson groupie. But I took my first class with them when I was in school. And then basically anything that I could get to after that, I did. I've done their 3-part series at least 3 times. And then I'm taking it again with my associates. It's not a 3-part series anymore. It's a hybrid online and then in person. But he is just such a wealth of knowledge. And when I tell you, like, there are things, I mean, like, just like anybody that's been in practice a long time, seen a lot of things, and like there are little nuggets that he'll drop that it's just like, okay, that was exactly for this specific patient. So I'll give you an example. I had a baby come in who had a brachial plexus injury. So, for those people that may not know what that is, this baby was a vaginal birth. So, she came through the birth canal. And in that, the provider pulled on her to try to get her out and tractioned her cervical spine so much so that it damaged the cervical nerves that go to the arm. So, when she was born, her arm was floppy, completely internally rotated, no use of that right arm. The mom wanted to breastfeed. The baby had a lot of cranial stuff from her birth and from not being able to move that one arm. And one little nugget that he said in one class was, if you have anyone with a paralysis, do cranial work and move the paralyzed side at the same time. Literally, he's never, like, he said that in one class. He's never said it again, right? And it was the one thing that I added in, obviously with adjusting and lots of other things with that baby. But I really think that it was that little nugget that made a difference for that little girl. She ended up crawling normally. She got full function of her arm. So super amazing miracle chiropractic story. But all that to say is he's like just a complete chiropractic genius. Love him so much, and love Dr. Nancy Watson too. She's I always say I go for the Marty seminar and stay for the Nancy seminar. So she's always in the back giving me life, mom, wife advice. And then Dr. Carol Phillips. So I had the privilege of also learning under Dr. Carol, who her company is called Dynamic Body Balancing. Dr. Rosen's is Peak Potential Institute. Dr. Carol, a small group of us convinced Dr. Carol to do a seminar in Houston, which is the hardest place to get a non-sports medicine chiropractic seminar together because nobody understands chiropractic. And so there were 8 of us in this seminar with Carol. So Dr. Carol worked on all of us, worked with all of us. We got so much one-on-one hands-on work with her because her dynamic body balancing series is 5 parts. So we had 5 weekends with her. It was incredible. And so she really teaches chiropractic cranial work from a very right brain fascial standpoint, whereas Dr. Marty is very left brain, very analytical, very cerebral. And the way that my friend Dr. Morgan and I teach together is we really meld both of those worlds, because as amazing as SOT is, and I use a lot of SOT in my practice, but it's kind of a rabbit hole. If
Yep.
anybody knows about SOT, you could be with a patient for 30 minutes or more, right? And then same thing with fascial work. I mean, you could work on somebody from like a fascial unwinding standpoint for an hour. And so what we did was we really combined the best of both of those two and melded them together in a very practical way to adjust the cranium in a very short amount of time while still getting really amazing results. So that's it.
That's really cool. That's really, really cool. My wife recently took your cranial class when you were up here in Dallas, and she was kind of explaining things. And this is more of just like a random question, but this is my lack of knowledge. Is there any relation to a lot of the cranial bones and the pelvis?
Oh yeah.
Okay.
So there's that's a good question. So it's a I believe it comes from SOT, but it's called Lovett brother relationship, right?
Mhm.
So it's a relation of each one of the specific cranial bones to specific parts of the pelvis. So,
Uh,
and like, you know, I would say too, one of the things that Dr. Morgan has really perfected is she's really into the fascia. So she also looks at the fascial plane, so lateral versus like cross body fascial plane versus anterior fascial plane, posterior fascial plane, and that impact with each one of the cranial bones
Yeah.
too. And we know the fascia, obviously, like they're huge. If you've ever been to, have you guys ever been to the body, is it Body World exhibit? There's some ethics
No.
with it, but
Yeah.
it came
I
to
don't
the,
vibe with I don't vibe with the ethics too much. Yeah, I'm not
yeah,
gonna learn what I learned.
I didn't know about that until after the fact. And then I was like, golly, guys, how did y'all let me come here? But it was really cool seeing like how much fascia is actually in the pelvis. Like, I mean, obviously some of us can remember back to chiropractic school too, but I don't think I was really tuned into that back then. But yeah, there's definitely cranial bones that relate back to the pelvis for sure. And part of that too, Zach, such a great question. Like when we're seeing kids that aren't crawling, and they have some weird like, hitch in their crawl and they're like lifting one leg, I'll actually check their cranium and
Mhm.
their pelvis, right? Because we know it's all connected.
Mhm.
Yeah, I mean, I think that helped me a lot. Like when what I always find is moms who have pubic bone pain on the same side, they always have some sort of like lateral sphenoid. And
Mhm.
like for you guys that don't know what that is, like you literally just take your thumb and you just put like just enough pressure to like blanch your nail, like really, really small, and you just see what happens. This is not an advice seminar podcast, but
Yeah.
and then like you have to think like when you talk about like the cranial sacral pump, right? They work
Yeah.
in reciprocal motion. Like so cranium expands, pelvis expands, cranium contracts. And so like they have to be connected.
Yeah.
Yeah. Because I had just been kind of, since Morgan and I had talked after your seminar, we'll have a lot of hypermobile patients.
Mhm.
And so I'm like working with the fascia and I'm like, there's got to be a connection here. I just was like
Yeah.
trying to be more
Yeah.
intuitive with it. But with you kind of made a comment and I just wanted to mention too. Do you ever wish, maybe not go back to school, but when you're learning stuff, you're like, dang, I know we touched on this in like gross anatomy. Like it'd be really cool to go back just for a second and just to
Yeah.
like kind of integrate it and then obviously pop back out.
Yeah. 1000%. TCC, the guy who used to teach anatomy there, he's not there anymore. It was trying to get up. He was teaching anatomy and neuroanatomy. And I was trying to get up there to like get back in the neuroanatomy lab just because I'm like, there's a few things I need to iron out in my brain. But absolutely. And like, so one of the ways that I always explain this to parents too is when two cells come together, we're a blob, and that blob has to differentiate, and so with that, the pelvis and the cranium, especially the jaw, are really closely related, right? And it's why when, for anybody who's had a baby or whose wife has had a baby, it's why whenever you're in labor they will tell you to relax your jaw, and it's so that way you can relax your pelvic floor muscles. So I mean, I always think about all of this as like God put so much secret code in our system,
Yeah.
and like you just have to figure out the secret code to like hack the system. But yeah, it's all connected. And like with hypermobile people too, Zach, I love checking their cranium because like when we think about that pumping mechanism, right? Like it could be that pump is overactive in one area, creating that hypermobility, right? And like less active in the other area. So potentially addressing the cranium could impact that hypermobility. I think there's a lot of reasons why we're seeing more I see way more hypermobility now than I ever did before. That's a whole like rabbit hole conversation with 5G and like EMFs and all of that I really think are impacting that. Just like true mitochondrial dysfunction. But yeah, that would be something to look
Yeah,
at.
I was like,
Yeah,
man,
I
we could
mean,
dive deep into that.
the whole like prenatal and pediatric space like really truly is specialized, like, and there's a difference between being like a general prenatal and pediatric wellness focused office, and then there's like a specialized office. And I would hope that we classify ourselves as like a truly specialized office. Like all of my continuing ed stuff goes into things like cranial work and embryologic development and the nervous system and prenatal care and all those kind of things. And that's where a lot of parents are always like, I've been to another chiropractor. Where did you learn all of this stuff? And like, how did you do that? And so, I mean, we don't get exposed to any of that. And so, what are you doing to help because you can't see every single kid in Houston, even though
Sure.
every single kid in Houston needs to see you. So what are you doing to like bring your associates up to the level to where they can kind of play in this field as well, like and be that? Like I know you said you're teaching the classes, but how do you kind of take somebody going from like I'm fresh out of school to like I'm really proficient in cranial work?
Yeah, no, that's so good. I had an intern one time. I think it was before she interned with me. I always make my interns come shadow me. And after she was done shadowing, I require them to come for pre-shift and they have to stay the whole day and then we sit and debrief after. And she told me, "I feel like you're speaking another language that I don't understand." And she said, "I literally don't know anything that you're talking about." So, with that, I would say it's a lot of education. It's one of the things that I'm really I would say passionate about in terms of educating my docs, but also when it comes to teaching other chiros too, is really helping them truly be an expert. Like there's so many things that we don't learn in school and that I can't really even. I mean, I finished all my stuff for my CACCP. I submitted my test, 77.3, so I have to take it again because you have to have an 80 to pass. So, I've done all the stuff, right? And there's so many things where I think it's integrating all of the knowledge that we have and then being able to really package it. So, what I do with my docs and with our interns too is we're actually really leveraging AI right now to
Nice.
we are recording all of our initial consults, all of our reported findings, and then we meet weekly to go over all the cases. And then I will give them if they have a question about, like, say, for example, a pregnant mom has a baby who's IUGR, which is intrauterine growth restriction, which is not something that I remember learning in chiropractic school. I don't ever remember learning that in any of my ICPA training. Basically what that means is that the baby, for a pregnant mom, the baby in utero is not growing at the percentage that they want the baby to grow. So the baby's at a really small percentage. And so it's a matter of like being able to really head that up each week. We go over each one of those cases and things that I would be asking the patient, recommendations that I would give for the patient, things we need to be looking at. We do insight scans in our office. So things I would be looking at scan wise, things I would be looking at exam wise, and then ways to coordinate that with other providers. So I'm really particular about who interns in my office as well as like my associates were both like one I prayed really hard for, the other prayed really hard for me. So that's how they both ended up here. And at the same time, I expect a lot of them in remembering the little bits of pieces that I tell them because I do think that's really where chiropractic kind of I would say misses the mark when it comes to pediatric and prenatal practice, right? Is that people are not obsessed with excellence in understanding the little nitty-gritty pieces that go into being so specialized, right?
I
Yep.
think you could have just said chiropractic.
Yeah, but it's like I think that's where I think that's my passion for teaching. I have another project that I'm going to be launching probably at the end of the year, if not very beginning of the year. So stay tuned on that. But it's a focus around that because chiropractic quite literally saved my life, and I've seen it do the same for so many patients. And I think that if we can really position ourselves as experts in whatever lane of chiropractic we want to do, right? Like that's really where we make the most impact because we like telling people like I came from a group of chiropractic where it was like if you would tell people like if they're subluxated they're gonna die, right? Like I mean it was
Yeah.
like subluxation equals death, right? And like although yes we know that's true, that's not helpful and that doesn't actually meet people where they are to then be able to bridge the gap between chiropractic and wherever that patient is. So hopefully that answered your question.
Yeah, I mean, okay, I think that there's like a lot of people who like hear us talk about these things, and I would feel like that most pediatric and prenatal chiropractors are super passionate. And I feel like there's like this big momentum or this big trend in chiropractic right now, especially amongst the students of wanting to be pediatric and prenatal chiropractors. But we know that like not everybody is cut out for this. And like the worst thing I think that can happen is having a chiropractor who's not on fire and not in their right seat because then your patients get a less than excellent experience. So What are some of the things that you look for in these people who come and intern with you, in these associate doctors that you interview? What's a good indicator that somebody is like meant to be a pediatric and prenatal chiropractor?
Yeah, that's such a good question. I would say so. I think that there are a lot, to your point, pediatric and prenatal chiropractic is super sexy right now, right?
Yep.
Everybody wants a super like cute aesthetic. I mean, I opened a practice when Instagram was like, you couldn't even post videos on Instagram, right?
Yep.
Like, it makes me feel so old, but I mean, it is what it is, right? And so, people were still really using Facebook. And so I say that to say people want a pediatric practice, I think because it looks cool, right? It's the same thing. I went to school with one of my classmates was like, I want to be a chiropractor because I know a chiropractor that makes a lot of money and I just want to make a lot of money. And I'm like, cool. That's awesome. Like, would never send a patient to you, right?
Yep.
And so when talking about people who really want to be pediatric chiropractors, I always want to know what their origin story is or what their why is, right? So, like one of my docs has a kiddo who she had in school. He really she comes from a very sportsy background and her kiddo really needed a lot of chiropractic. And so that's how she got into chiropractic. My other doc did not know she wanted to be in pediatric care, but was just really willing to learn and really was able to connect with kids. And so that was huge in just her ability to be able to see kids and pregnant moms. And she really you could tell it was one of those things that she didn't realize she had in her. I would say, to answer your question, like, it's really like your why of like, why do you want to do it? Is it because it looks cute and it seems fun? Like, trust me, getting thrown up on like
Oh my gosh.
at least twice a week. Breast milk is fine, but formula is like so gross. I mean, we had to give our son supplement with formula, so no shade in that arena. And at the same time, it's still gross.
Mhm.
Like the amount of times I've like had like poop on my hand can't even count, right?
Yep.
So it is not like I've gotten like bit by kids,
Yep.
kicked by kids, right? So it is not as sexy as it sounds. It can be so rewarding, right? But like you have to really have your heart in the right space and be really wanting to serve people from a good place to be a pediatric chiropractor. And I would say another thing is what I've seen with a lot of students coming out is like you guys have had access to so many more resources than I did even 10 years ago, right? Like even though like our gap of graduating was like about what 7 years ish,
Yeah.
you guys have, I mean, insane amount of resources, which is huge for your level of communication of chiropractic, understanding of chiropractic, y'all's ability to adjust, right? Is like, I'm like, holy moly. Like, thank you, Brett Jones, for like actually like teaching people how to adjust before they graduated. And at the same time, there are a lot of chiropractic groups that teach pediatric chiropractic that, in my opinion, is a very surface level chiropractic. So depending on how sold out people are for that, also is an indicator of growth, if that makes sense. So like I want to know that people are hungry to learn more, willing to learn more. They want to continuously up level versus feeling like they've achieved their level of understanding when it comes to pediatric chiropractic.
Yeah, I think that like one of the biggest things that like people ask me and they're like, I want to be at a pediatric chiropractic office because everyone just loves to be here in your office or the community is just so tight knit. And, when you get thrown up, bit, and kicked by the same kid all in one visit, and then you walk in the back, you grab one of your extra shirts because if you're a pediatric office and you don't keep extra shirts in the back because you know that this is going to happen, then like you're not running a real pediatric office. You change your shirt all for it to happen again,
Yeah.
literally the next kid, and you have to just be like, hey, I loved you anyway, and continue to move on. I think that you can create that same level of community, and I think the person who does that really the best that I've seen is Zach. Like Zach has a really awesome adult wellness like and pain focused chiropractic office, But dude, the amount of people that show up to your events is just awesome. Like you have a really engaged community. And so I think that if you're looking, like for people who are listening to this, if you're looking for a community centered practice and you're not sure if kids are your thing, like you don't have to be miserable and like see kids that you don't want to see and still have your community, like it's not all this like it is fun games literally, but it's not always all fun and games. Like you have to truly have a heart for like these kids. And like when you have a mom come in your office that you've been seeing and you're working on her for fertility and she says that she got pregnant and then has a miscarriage and like she's like crying, that's like the hardest moment I think that I've had in my practice so far. Is like that first miscarriage was like that was really rough for me. I felt that for a couple days. And so like you said, being prepared that your heart is ready for those kind of things.
Yeah, I mean, I will say like that is such a good point. I mean, like I said, grew up in a chiropractic group, like a group of big, like networking group of chiropractors, right? Where they saw everybody and they had great community and great events and like, just really teaching people. I mean, that's how I literally learned that the Splenda that I was putting in my coffee that my neurologist told me to be drinking was part of what was causing my migraine headaches, right? And, like those were the people that, back then I was telling somebody this weekend actually, we were talking about that and I was like, you remember like we would have the workout DVDs and we would do them in the office with patients. And like I would do like these like DVD workouts at school, right? Like in a secret room because TCC was very anti all of that stuff. And like there's so many good things about just an overall like adult practice that like truly still leaves like a legacy, truly still like changes people's lives. And like there's community in that. There's community in people doing life in the same way and choosing, chiropractic as part of their longevity strategy, right? That like doesn't have to be pediatric focus. And to your point too, Spencer, like like that first like miscarriage like hit like hard and we still like that's one of the hardest things is you have to really be prepared for the highs and lows, right? I've seen moms get pregnant after 2 rounds of IVF, told they'd never get pregnant. The baby gets adjusted, then the mom's like, I'll start getting adjusted. And then we had a mom get pregnant after she started getting adjusted. She had Harrington rods, and the dad, very straightforward guy, was like, wait, you guys saved me so much money by her getting pregnant and not having to do IVF. You guys saved me like $5,000. We're like, please don't tell your kid that, but like got pregnant after having to do IVF. Right. But then like, I remember one of the hardest days in practice for me was I had a patient who was a childhood friend of mine who drove over an hour to my office to get adjusted, who was, preparing for a VBAC. And I remember adjusting her and talking to her baby. And his name was Owen. And I remember talking to Owen and being like, okay, Owen, she was after 40 weeks. And this mom really trusted herself. She really trusted her baby. She trusted her body. And Owen ended up being born. That was like a Thursday. Owen ended up being born Saturday, stillborn. And like, it still like makes me want to cry and gives me goosebumps. That was the hardest day, right? Like having like literally just talked to that baby and like him kick my hands and, just like loving on that mom and like telling her like how amazing she was and all of this stuff, right? That like you have to be okay with that. And that's the hard part that's a totally unsexy part about pediatric and prenatal practice, right? Because then how do you make that mom feel safe in your office again when other people are holding their babies and hers she cannot hold, right? So like that's the part that for the people that want a pediatric practice, that's like the super crappy stuff that you have to deal with, but then you get the freaking miracles too. So yeah, definitely not for the faint of heart, but it's for people. That's why I think you really have to have the heart to love on those people to really be able to hold space in both of those areas.
I think too, not to divert too quickly off of the subject, because I think it is a really important thing to like sit with.
Yeah.
But I think another key aspect to knowing whether or not, and something you've mentioned a handful of times, is how many times you shadowed offices while you were in school and you were an associate for a little bit. I think that's something, Spencer and I are both big on, but I think no matter what type of practice, but especially something super niche like pediatric prenatal, is getting in those really high level offices
Hmm.
for a day, a week, whatever allows you to, whatever the doc allows you to, just so you can really see. Because one shift in an office, as all three of us know, you might see some really cool things, and it might be, all the wellness people are coming in that day, and things are gravy. But I think that's really important. I did want to ask, because I know you've done the sales girl stuff and like all that. So I know you like a little different subject, going more business style, but a common thing, at least in like the pediatric prenatal, is like getting dad signed on with care. Like get not necessarily signed on for care, but like making sure he's on board. So how are you handling objections in the pediatric prenatal world?
Yeah, no, such a good question. I would say like to your point of shadowing multiple offices, I remember on break and like, like I said, like I didn't have anybody. I remember when I was in chiropractic school, I ran out of like student loan money and like hadn't been working, like hadn't done a marketing gig for a chiropractor, and literally was using Kleenex for toilet paper, and asked my like one of my aunts, who was super sweet, sent me a gift card to the grocery store so I could go buy toilet paper. So I say that to say is like my breaks were my time to make money. So like those 3.5 weeks, like I was crushing it, making money, waiting tables, like doing whatever I could do. But I would go visit as many offices as I possibly could. And I would think about like a whole sensory experience of what it would feel like if I were in this office. And is that what I
Great
really
point.
wanted? And I can definitely say that the office that I have now is the office that I literally dreamed of in all of those instances. So I think that's a super great reminder for people, is visiting as many offices as you can, because everybody's going to look different. Everybody's is going to look different, smell different, feel different. They're going to say something different. They're going to have different music, all that stuff, right? So what was your question about business stuff? Ask it again. Sorry.
Handling
Oh, objections with
handling and
that.
overcoming objections in a
So
pediatric prenatal office.
So what I find is that dads are the protector of the cave, right?
Mhm.
So their biggest thing is they want to make sure that their baby and their wife is safe. And so most dads, like most men, love visual things. So they have seen chiropractic on TikTok, on Instagram Reels, on YouTube, right? And they've probably seen ways that people adjust that does not look like the way that I adjust. And so I always like start with that of like, this is not what you saw on TikTok or Instagram Reels. And I think that like at first eases their mind. I think acknowledging that, like acknowledging the fact that they really are just there to protect their wife and their baby, and they want to make sure that whatever you do is going to help them and it's not going to be a waste of time and money. And
Yep.
so I think with that, letting people know, like I think when people come to my office, like I'm fortunate enough that I have enough of a reputation that people like, it's like I have the highest new patient fee of any chiropractor in Houston, a pediatric chiropractor in Houston, right? And so like if people are paying that kind of money to see me, like they've already kind of vetted me. And I created it that way because I like the high barrier of entry. But anyways, so I would say overcoming the objection of dads wanting babies under care is just really meeting dad where he is. Hey, I know you want to make sure that we're like keeping your family safe. We're not wasting your time or money. And that's not what we're here to do. Right. Like, I like to give him an example of like what we've seen. If it's a case at this point, really there isn't a whole lot that I haven't seen. But if it's a case that I can give them an example of, I always try to give the dad an example of that case, because then that's proof. It's like social proof almost for him. And then I like encourage their questions. And normally it's like, how long is this really going to take? And they don't like this answer, but I'm like, it depends, right? And I don't have a like, I'm not so married to eye care plan in my office. I'm not so married to the care plan that if a baby isn't improving, their scans are if a baby is improving and their scans are improving before I predict them based off of the care plan to improve, I tell the dad, hey, if we see changes before I think they're going to happen, I'm happy to cut those recommendations down. So that addresses his objection of time. And then money, I always tell them the reason why I planned it like this is because I want to maximize our time and efficiency so that way you don't waste your money. And I know that I can help you, and I don't want you to waste your money. Like, I see a lot of kids that have been in other offices, and so that really gets me fired up, because I literally hate it whenever people's time and money are wasted in a pediatric, air quotes, office that doesn't know what they're doing.
Mm-hmm.
So I'd say that's how I handle those objections, is really understand where they're coming from and really meet them where they are on those objections. Because I think at the end of the day, like, the dad wants their kid taken care of, right? Like, and the dad wants their wife taken care of. They just don't understand what it is that we do. So being very clear about that. And two, I would say, understanding kind of where that data is. Like, is he an engineer? Does he need like the data, right? Does he need to see the scans? Does he need to know like objective measures of what's going on with his kid? Or is he just like kind of clueless and doesn't understand? It feels like he's being talked over, and I have to really like break it down piece by piece with him. So yeah, I would say that's how we handle it in our office. And I love when dads come, because I want to get the dad on board.
Yep.
Because if I can get a dad on board with his kid and his wife getting adjusted, that makes my job so much easier than the let me talk to my husband conversation, right?
Mm-hmm. Whitley, to kind of wrap up, there's so much that you covered, and I feel like the pediatric world is so vast, and there's so much to learn. And especially, coming right out of school, not all of us have kids, right? Like, I mean, we don't have kids yet, and yet we have a pediatric office. I mean, you guys just have work 2 years ago, right? And you've been in practice way longer than that. What would you say, or what's your words of encouragement to maybe the younger pediatric doctors who may or may not have kids or may not have taken all the courses? What would you say to the pediatric docs who are just getting started, that are in the place of feeling like, I just don't know anything, I'm not qualified to tell these moms what to do with their kid, etc.?
Yeah, such a good question. And I would say it's so funny, because had you asked me before I had Warwick, my answer probably would have been different. Now, after being on the dark side, I always joke that I was hazed into the mom fraternity, or sorority, I guess. But I was hazed in my initiation process. But I would say, if God put it on your heart to be a pediatric chiropractor, then take that as your proof that that's what you're supposed to do. I think that we can really, in any arena, have imposter syndrome with anything that we're doing. And one of my mentors said, we always are an imposter of whatever our next version of ourselves is going to be. So essentially, we always are an imposter, because we all know that we all have huge plans for our lives, and God has huge plans for our lives. And so we're never in that version of ourselves, right? So I think with that, the biggest piece of advice is being with moms. And that's not like, how are you? Tell me about like the awesome things about your baby. It's like, no, really, like, how did your baby sleep? No, really, how is breastfeeding, right? Breastfeeding was one of those things that I think that as a pediatric chiropractor, not having kids, I was like, oh yeah, it's hard. It's like really hard. And moms have nipple damage and whatever. No, it is freaking hard. It is like so freaking hard. So I think like having community with your patients and really listening to them and really sitting with them and asking those deeper questions, that how are you really question.
Yeah.
Tell me what your struggles are, and really being able to sit with them in that, I think. And two, like, some of the moms in our office, the dads don't want the kids under care, right? And so talking with them about that, talking with them about like, what is that like? How is that for you? How can we support you in that? I feel like as a parent, there's so many more things that I realize, I like thought that I knew. And I think that you can't really ever know until you get to the other side, right? But just like really being there with them, I think, and asking the questions at least gets you a little bit closer to where they are, and makes them feel like you can relate to them just a little bit more, even if you haven't been there.
Yeah. And jam-packed episode. I mean, basically, you're like, living my life, but 10 years ahead of me. So
Yeah.
man, it's so good. Zach, you got anything else to wrap up?
I think just the burning question in the room for probably myself and other listeners is, where can people get connected with you and learn more of what you have learned now that you're teaching?
Yeah, thanks, Zach. So they can find me on Instagram at dr.whitley, Whitley. Also, the Cranial Chiros. We have a class coming up. Our Hill Country course should be really fun. It'll be in Canyon Lake, and it is in November. It's the 8th through the 10th. So that will be lots of fun. And then, yeah, have some stuff coming down the pipeline to hopefully help people be more of an expert in pediatric care and exam, initial consultation, communication stuff. So I'm going to be excited to drop some of that soon too. So be on the lookout for that as well.
Super cool. Super cool. Well, thanks so much for joining us on the What Now podcast. We look forward to more conversations with you, and this really was an awesome episode. So thanks so much.
Thanks, guys.
See you guys later. Peace.